name is Lauren Hall, and I'm a student at the University of Missouri studying health sciences, and I'm an intern at Missouri Rural Health Association. I'll be discussing infant mortality in rural communities while focusing specifically on rural Missouri. So I will be covering what infant mortality rate is and what it is based on, why rural communities are at risk, and how rural communities in Missouri can reduce the IMR. I chose this topic because infant mortality rate is an effective gauge for determining the overall health of a population. These infant deaths are important because they not only take an emotional toll, but also a financial toll on families and impact the community as a whole. So the IMR is based on the number of infant deaths per 1,000 live births. Infant mortality is the death of a baby before their first birthday. And I will also mention maternal health care as well as maternal mortality, because both significantly contribute to the infant mortality, as the mother's health is an indicator of the infant's health. Maternal mortality is the loss of a mother's life while she is pregnant or within 1 year of the end of pregnancy. This is due to the pregnancy or its management, not to accidental or incidental causes. In fact, over 21,000 infants died in the United States in 2018. So the leading causes of infant mortality among Missouri are birth defects, preterm birth, low birth weight, maternal pregnancy complications, sudden infant death syndrome, also known as SIDS, and accidental injuries such as suffocation and chemical exposure. There are many barriers to healthcare when living in rural communities. And these are, the top three are lack of access to healthcare, limited education, and poverty. There is a lack of access due to a deficiency in financial resources, such as Medicaid. There are less physicians willing to work in rural areas, and therefore lack of hospitals due to hospital closures. This means there are little to no specialists for underweight babies, prenatal care, pregnancy complications, or even emergency help for delivery. Due to these risk factors, the infant mortality rate in rural communities was 6.55 per thousand, which is 6% higher than the rate for small and medium urban counties, and 20% higher than the rate in large urban counties, which is 14% difference just between rural and large urban counties. So to summarize what is causing the increase in infant deaths in rural Missouri, our rural regions had significantly higher rates of teenage pregnancies compared to urban counties, which explains the higher rate of underweight babies born. Pregnancy-related death rates were 47% higher and significantly greater for rural counties. The rate of injury-related infant deaths was nearly 3 times higher than the national rate, which is partly due to lack of education and caring for infants. Missouri's infant death rate was 10% higher than the most recent national rate of 5.7 in 2018. Rural counties had an infant mortality rate of almost 700 per 100,000, while urban regions recorded a rate of 650. That is 50 more infant deaths just in rural counties. And the total reported infant deaths was 5,620 in Missouri. Another factor that affects the IMR is that races are disproportionately affected. There was a study comparing the ratios between African American and Caucasian infant deaths. The study in 2013 showed the ratio was 2.1, while the ratio in 2018 was 1.9, which indicated a 10% decrease between the two races. So the gap is closing, but there still needs to be some improvement. To assist with this issue, there are many organizations that have been developed to offer support and financial assistance, as well as infant rearing education. So I'll mention a few of the organizations I have listed here, and know that the number of organizations available are not limited to this list. Safe Cribs for Missouri is a program that provides cribs and safe sleep education to low-income families for obtaining a crib. The goal of the program is to support families and reduce the risk for sleep-related infant deaths. There is also telehealth, telemedicine services offering video conferencing calls, prenatal check-ins, provides mothers the ability to ask questions, and also support for single mothers. The Caring Recovery for Infants and Babies Crib Act, which is similar to the Safe Crib program I just mentioned earlier. Also, there's home visiting, which is what it sounds like, and also Missouri Foundation for Health. As a side note, there was an investment in $20 billion in rural internet infrastructure to improve telemedicine capabilities. Overall, the rate of infant mortality has shown some improvement that in a 10-year span went from 800 to 600 deaths a year. So what can rural Missouri do to reduce the infant mortality rate? They can take advantage of telehealth and organizations, ensure that you are sharing your stories and struggles with healthcare professionals to get the message out. Do your own research, and also you can take advantage of midwives, which they are typically used for those who want to give birth naturally without drugs and medication, but they are also a good source for those who have no other resources. Other ways to reduce the IMR are for mothers to eliminate the use of alcohol, drugs, no tobacco use, take folic acid, maintain a healthy weight, control chronic conditions like hypertension and diabetes, reduce exposure to infections, and if possible, completing newborn screenings. Additionally, mothers and fathers could focus on creating a safe sleep environment for an infant. And here are my references in case anyone wants to do some background research. And thank you for watching.